Hello everybody, we will start to explain Krok 1. As you see, Krok just a game. It's about keywords. He will give you word and we need what is this refer to, like word, just word equal another word. Don't forget to subscribe and support me. This is the first question that we will discuss. Here, first of all, we will read the last words. What is the drugs for choice for this treatment? He asked about the drug. If we see from this, all of this just symptoms. Here he say about amoeba dysentery. We should know like what the drugs that we use to kill amoeba dysentery. It is metronidazole. What metronidazole? It's just antibiotic. Its mechanism like to destruct or destroy the DNA in this bacteria. We should know that amoebic dysentery we can use antibiotic metronidazole. Okay? The second question here, the following diagnosis is characterized by. That means he asks you about disease. Here, quite often the cause of secondary immune deficiency. First of all, he asks about something called secondary immune deficiency. Immune deficiency, like the immune system not working. It's just two types, the primary and secondary. A primary, it like neutrophilic defects, humoral complement C, like T cell or severe combined immune deficiency. This primary, you will born with this disease from like embryo. But the secondary one, you will receive this disease during life. That means like immune deficiency is the most common one. That's why he asked here about the secondary type, and you should know the AIDS. It's another name for secondary immune deficiency. Secondary immune deficiency. Okay? Here, if we notice, he ask about sinoatrial node, condition of the following conductive system of the heart. Here he say heart rate of 30-year-old man under emotional stress reached 112 like beats per minute. We should know sinoatrial each one how many beats it create. Sinoatrial under normal condition from 60 to 80, but in stress case from 60 until to 120. That's why we choose sinoatrial. Purkinje fiber is just from 20 until 40. His bundle of Hess or Hess bundle, both of them also to 40. But atrioventricular just from 40 to 60. Atrioventricular node. Here it's just about the calculation. He will ask you about two calculation, Colli theatry or Colli index. First of all, we should determine Colli theatry by this calculation. It always 500 over 2. It's equal to 150. This number he will give you, and you should know that we will divide it by 2. And after this, we determine Colli index. Colli index, it's 1000, and this number you should know by yourself, over 250. It's equal 4. Now, Colli index, he asked first of Colli index, that means 4, and qualitative 250. If we see here, it's asked about something called Duchenne syndrome. Duchenne syndrome is like disease that causing or destroy our muscle. When we have dystrophy of our muscle, that means we have markers in our blood that can determine if it like destroy of muscle or another things. But for Duchenne's dystrophy, for its creatine phosphokinase, this enzyme, it's created from our muscle when it like destroy or destruction, it will be creatine kinase. It is just markers. We will make deal together about question about base morphology. We have 3 words or 4 words. We will determine each word what it refers to. Here, if we read from the beginning, we will see septic spleen. That means it's septic. Here you will see, like, if we complete the reading, you will see staphylococcus. Okay? And also you will see it's staphylococcus, it's for bacterial. That's why it's bacterial. And we should to determine like endocarditis. That means endocarditis, that's inflammation. Okay? What it cause of inflammation, or which words it refer to the inflammation. Here we have immune complex, one of them, like infraction, another word that we can determine each word in this question. In this question number 10, he will ask you about something like what kind of hypovitaminosis happen. Hypovitaminosis, that like decrease in vitamin. Okay, here he have patchy hemorrhagic. What it refer patchy hemorrhagic? Hemorrhagic, it refer to vitamin C. But if he say something about cofactor and bleeding, it will be vitamin K. But bacterial hemorrhagic, like hemorrhagic under skin, it will be for vitamin C. And we have a lot of like symptoms for deficiency of vitamin C, like slow of wound healing, gingivitis, and like impairment of the immune system, and another things you can choose, but it's the most common question about the bacterial hemorrhagic in Krok question. Here, what he say the answer is empemia. Okay, and if we read the last 2 line, the name of the clinopathological form of inflammation in the pleural cavity, and we will see the greenish yellow. This is word referred to inflammation. Okay, and we will refer in where is this inflammation happen in the pleural cavity. That means inflammation in pleural cavity, it is embemia. As we see here, some yellow liquid between or in the cavity. That's mean embemia. Here, researchers isolated 5 isoenzyme forms of lactate dehydrogenase of the human. What properties indicate the isoenzyme form were isolated? Here, if you see 5 isoenzyme. What isoenzyme it's called? Isoenzyme it's a multiple form of the same enzyme. That's mean each 5 enzyme or isoenzyme have the same properties for this one, but just different in chemical or physical structure, but the same function. That's why it catalyzation is the same reaction, like it makes the same reaction. Here in this question, he will ask you what type of the drugs incompatibility it's the case. First of all, patient suffer from what? From the ulcer. That's why he take anti-acid drugs. In the same time, he take antibiotic. But antibiotic fever didn't fail because of antibiotic. That's mean antibiotic with anti-acid it not absorbed. The absorption will stop because antibiotic need acid medium to be absorbed. That's why we choose pharmacokinetic absorption assay. What's mean pharmacokinetics? Pharmacokinetics it's mean the effect of our body on the drug from absorption, metabolism, distribution, excretion. In this question, he will ask you about ECG. Okay, of the patient shows sign of hypertrophy of both ventricle and right atrium. The patient was diagnosed with tricuspid valve insufficiency. Okay, he will ask you what dysfunction is usually observed in the case or what pathogenic factor or variants. Such insufficiency is heart overload by volume. Okay, we have two types of overload. It from volume and from resistance. This in vessel or hypertension. Here when we have problem in the heart. That's why he asks you about hypertrophy, or he say hypertrophy of both ventricle. That mean heart overload by what? By volume. Because we said volume refer to heart, resistance refer to vessel. In this question, he said, what is the natural proserine and hallucine interaction? We should know what is the mechanism of proserine and hallucine. Hallucine increase response to GABA, increase a channel blocker for especially potassium. That means relaxation. This is one mechanism. And neostigmine or proserine, this one, it's called also proserine. Proserine, what it lead? Inhibition of acetylcholinesterase to lead accumulation of acetylcholine. That means like increase contraction. Okay, this one lead to contraction by inhibition of this enzyme. And hallucine, it relaxation of the muscle by another way. That's why we choose indirect function antagonism. Antagonism like the dot. This work in way and this is in another way by indirect functional antagonism. Sorry. He What regulative mechanism is responsible for this change? Okay, we should determine what is the change will be. The minute blood volume in the patient was transplanted heart has increased. Okay, here there is no reflex. Okay, it just physical work lead to increase of the heart or increase of the blood volume. That's because of catecholamine. It's noradrenaline and adrenaline. Okay, we will not choose sympathetic or parasympathetic because parasympathetic is increase everything. Sympathetic it increase, but we will not choose this one here because it not reflex. Not reflex tachycardia. It not reflex for bradycardia or something. It just because of physical work. When we make any physical work, adrenaline and noradrenaline in our body increase secretion from adrenal gland الميدولا. Okay, in this question he say an aged man had a rise arterial pressure under stress. It was called activation of what? Okay, sympathetic and parasympathetic. Sympathetic increase everything in your body except the GIT, gastrointestinal tract. Increase respiration, increase heart rate, increase everything. Parasympathetic, it decrease everything, decrease heart rate, decrease respiratory, decrease everything in your body except GIT. It will be increase. That's why when we watching film, when we have parasympathetic, we eat a lot because GIT it's working. But when you have sympathetic system, it's working that you in stress, there is no time for eating. That's why we choose sympatho adrenal system. Sympatho is sympathetic. Adrenal, we said about adrenal medulla for noradrenaline and adrenaline. They also increase heart rate and respiration. If we focus in the question, the answer it will be very easy. Tiger heart. What mean tiger heart? Tiger heart when we have our heart, but we have accumulation of some lipid. This lipid it accumulated on our heart. What it's called? It's called tiger heart. That's why we choose fatty parenchymatous degeneration. It refers to tiger heart. In this question, what material should be? Okay, a 55-year-old male patient was hospitalized to the surgical clinic for suspected what? Septicemia. What means septicemia? It's like toxin or poison in what? In blood. That's why when we want to make the determination, like make sure if it's septicemia or not, what we will take? Blood sample. That's why a blood sugar broth. In this question, if we read the first line, a patient has blegra. What's mean blegra? It's disease caused by deficiency of B3. niacin. It's a vitamin. Okay. B3, that's mean like have three symptoms: dermatitis, dementia, and diarrhea. Okay. Okay, he asked about the disease caused by deficiency of the following substance: B3, niacin. When our body need to synthesize this and this vitamin, it use what? Tryptophan to produce what? B3, niacin. This is why if we haven't or deficiency in this substance, lead to deficiency of the vitamin B3, lead to pellagra. In this question, we will read during examination of 6-year child, a doctor revealed gravity film of parenchymal is pharyngeal tonsillitis, and bacterioscopy revealed 2 gram positive club-like. Club-like, first of all, it referred to what? Bacteria called diphtheria. Okay. And diphtheria, it defect the main 3 organ in our body: heart, liver, kidney. Okay. This is why we toxic lesion, like lesion destruction of the tissue of what? Of the heart, liver, and kidney. If we read this question, we will see about joint pain. Okay. And revealed increase of what? Uric acid. Uric acid, and the most probable case disease intensified of the following substance. That's he asked about what is the substance. If it increase, the uric acid will increase. This is uric acid. Before it, xanthine, iboxanthine, inosine, adenosine, and this what? Adenosine monophosphate. This means if we have increase of adenosine monophosphate, will be increase in uric cycle. A 12-year after acute attack of retinal vein patient presentation jump aspartate aminotransferase. This is the keyword, aspartate aminotransferase. What is aspartate aminotransferase? It just markers, enzymes. Aspartate aminotransferase, it lead to what? Like when it increase in our body, refer to what? Refer to myocardial infarction. All these marks refer to cardiac marks, like creatine kinase, aspartate aminotransferase, lactate dehydrogenase. We have another marks like ALT for what? For liver. LL. But AST for what? For heart. Also we have LDH1, LDH5. This is also liver. LDH1, it's for heart. It's just marker. Like if we have increase in this enzyme in our blood serum, that means refer to myocardial infarction, viral hepatitis. Here he say aspartate aminotransferase, that means myocardial infarction. In this question, it's question about anatomy. What he say? He say like weakness of palmar flexor muscle alternated skin sensitive of 1 to 3 finger. Okay, here he ask about what? Ask about this finger. And this finger we should determine or know by ourselves, like median nerve, it innervates this part. Okay, ulnar nerve innervates the fifth and half of the fourth finger. Okay, that's why we choose medianis, because it innervates this part. If we see in this question, we will see what? He present vomiting after having meal. Okay, there is what? Phenylpyruvic acid in urine. This is the key word for this question. Phenylpyruvic acid in urine. Because it's phenylpyruvic acid, we need to synthesis of phenylalanine. Okay, and this is also amino acid. And if we have destruct of this amino acid, it will go to phenylpyruvic, and this will excrete in urine. What is the kind of this metabolism distribution? It's easy, amino acid metabolism, because phenylalanine is not lipid, it's not carbohydrate, it's not also water, it's just amino acid. If we read this question together, we'll see what? Aneurysm, rupture of thoracic aorta. This is the key word. Aneurysm, that means weakness of aortic or aorta vessel. Okay? And what he say? He say like, what pathological process cause weakness of the arterial wall and dilation of it, like it lead to rupture? That's why we said functioning of elastic fiber, because if we take a look to the wall of this vessel, we will see internal elastic membrane. This is protect our vessel from what? From rupture. From rupture. When we have like heart pump blood, this elastic help to not like some rupture here happening after what? After pumping of the heart. That's why we choose elastic membrane, like functioning of elastic membrane or impairment of elastic fiber. In this question, we see myasthenia from a patient suffering from myasthenia. Has been administered what? Broserine. Okay, function of broserine, that's neosystegmine, like to inhibit acetylcholinesterase, like to accumulation of acetylcholine. Like if we have more dose of neosystegmine, how we can help this patient? By giving of what? Look, atropine, to inhibit the inhibition of this drug. That's why he asked you what drug should be helped in what? In intoxication. It will be atropine sulfate, because atropine, it directly inhibition of working of neosystegmine. It's called also broserine. It's always given broserine in the Krok. Okay, thank you. Don't forget to subscribe.